Well, California is trying to keep hospitals functioning during this Omicron surge.
Yeah, the state's public health department is saying healthcare workers who test positive actually can remain on the job through February 1st. Now, this only applies to workers who are asymptomatic, and they will be required to wear N95 respirators instead of standard medical face masks. And the health department says, when possible, it wants those workers to only treat patients who have already tested positive for COVID-19. Joining us now to talk about the surge and workers on the front line tonight is Dr. Ali Jamehdor, the medical director of emergency services at Dignity Health St. Mary Medical Center in Long Beach.
So, Doctor, thank you so much for joining us.
Thank you. Hi, Susie. Hi, Jeff. Thank you for having me on. Appreciate it.
Well, Doctor, how are you and your fellow healthcare workers faring at your hospital? Are you fully staffed?
So, there's no sugarcoating this topic. I think it'll be very difficult to find any hospital in the Southern California that has not in some way, some degree, been impacted by this most recent surge. Our hospital was fairly ahead of this surge. There was a lot of planning and hiring going on before this came about. And yet here we are, and we definitely feel some of the stressors and are definitely impacted as well.
And Dr. Jamehdor, we're hearing some local hospitals are canceling elective surgeries once again, and others are considering it right now. Is that happening at your hospital?
Not currently. We're definitely reaching the tipping point here. And just like you said, there have been some hospitals that I'm affiliated with at other Southern California hospitals that have started that. And basically just, it comes down to manpower and having the capacity to do that. And I think most hospitals are starting to get close to that tipping point. We have not officially gone into that point currently.
So, Doctor, the COVID cases in this latest Omicron surge continue to go up here in LA, but Dr. Fauci has said it will go down near the end of January. If you look at the data from the East Coast hospitals, like in New York, have kind of hit a peak. So do you see an end in sight, and how do we get there finally?
Sure. I mean, that's a great point. I think we're in the middle right now of the Thanksgiving and some of the Christmas events that had the surge initially start up. And now we're starting to see the effects of New Year's. And so certainly this is, I think we're kind of starting to get to the peak of the surge, is what it feels like. Mentally and physically. And so hopefully as this kind of continues on its usual trajectory that we're used to seeing, we can start getting to a deceleration of the surge and get to a better spot in 2 to 3 weeks. It's not going to do it by itself. Things don't get better just because we want it to get better. And so hopefully the public can continue to do what we all know works and what can keep us safe and try to get us to a better place.
All right. Dr. Ali Jamehdor, thank you so much for joining us once again. Thank you for all that helpful information.
My pleasure. Thank you. Be safe. Thank you.